Hello, hello. It's Fabulous Friday right here on the new OPNS 97.1. Good morning. Good morning. Good morning. Now, how many of you are still laying in the bed looking at us right now? Only because you ate too much yesterday. I can talk about it because yesterday I had to drag myself to the bed. So I don't know about you. Today is our Fabulous Friday with none other than Mr. Eugene Poole. Mr. Poole. Hello, hello. Now,
Good morning. Good morning, and OPNS listeners. Good morning. Praise
how
God.
are you doing today? Did you have to drag yourself to the bed yesterday because all that turkey?
I had to drag myself out of the bed.
This morning, I said, oh, wait a minute. Tomorrow's Fabulous Friday. I can't sleep late. So we
Yeah,
got to get up.
yeah,
Oh, God. How much do we have to be thankful for? Even though we know that this was, Thanksgiving week. Traditionally, I tell you, I'm thankful all year long, especially this year. How about you?
absolutely.
It's been
Yes.
one for the books.
Yeah, especially with this COVID thing. It's
Yeah.
incredible.
Yes, sir. Yes, sir. We're going to touch base on some COVID business a little bit later. But all right, for those of you who are new to the Fabulous Friday platform, we do this every Friday morning. Mr. Eugene Poole is with Benefits Align. And at the end of the day, we need to know what we need to know when it comes down to the world of health coverage, health insurance. And he has been our teacher. Oh my goodness, our professor. There's been some things that I have learned in these last 5 weeks that has blown my mind and also broadened my horizon on how to understand our health coverage and the financial impact that it has across our life if we don't have any, especially this 2020 year. So we're going to talk about some key things. We're going to share some key nuggets with you on today. Grab your pen, grab your piece of paper, grab that bill you've been trying to figure out how to pay because I'm pretty sure he can help you with that too today. So, Mr. Poole, welcome to another blessed, fabulous Friday.
Thank you again, Chandra. Always a pleasure
Yes,
to
sir.
see you.
Yes, sir. So we want to go ahead and open up. Definitely, I always like to touch base on the fact of open enrollment. Open enrollment. We're in the middle of it right now. If you can recap and touch base for our viewers on exactly what that means, what is open enrollment, and what does it mean if they miss this period?
Right, right, right. So every year between November 1st and December 15th for most states, and some states take it as long as January of the following year, we have open enrollment, which means that you can apply for health coverage and apply with the process of applying for health coverage will classify you based on your income and your family size and the jurisdiction and zip code where you live. And so what happens is that either you'll have qualified for a free program, or you qualify for the Affordable Care Act, or you can pay for it yourself. But it's the one time in the year that we can get coverage without any regards to pre-existing conditions and medical questions and any of those things. Okay, that's the first issue. The second issue why you should do it is because I know that a lot of people are afraid of commitment, financial commitment. So what they figure is that, you know what, my money is funny. We say, as we say in the community, my money is funny, so I'm not going to apply for this. I don't know from one month to the next month, from one day to the next day, what my money's going to be. Well, the way the system is set up is that if your money is funny, it gives you an opportunity to go back in and change it so the premium that you don't think you can no longer afford, you can change it, and
It now becomes
and it
affordable.
becomes affordable again. You can change it every month. You see, so as soon as you know that your income is changing and all you do, because you're in the system, you go right back in the system. You can adjust how much credit you want to get, how much credit you don't want to get. Maybe you took too much credit last year, you end up owing money the following year. It has all of those features. A lot of people think that when they do the open season, it's kind of like you join it, you set it, and you forget about it. That is not the way it works. The way it works is that you can go back in and say, oh my God, I'm not going to get paid this month or this week or whatever. You can go back and make an immediate change to the system, and the system will adjust your premiums downward and upward based on what you tell it.
So it's almost like you're saying you're in control of the button.
You're in control. What happens is that people are so afraid of commitment. that they don't even apply, or they're afraid of maybe someone is just spying on them for one reason or another. You know, they have all these fears. And so what happens, because of all these fears, you miss the blessings that are available to you.
That's good. That's good. And that'll preach, Mr. Poole. That's, oh my goodness, all the fears you're missing the blessing.
Yeah.
Uh oh, that'll preach. You stuck me right there. Um and it's amazing the things how you say order of operation. We
Hmm.
have a list. We have an order,
Hmm.
that we do things in.
Hmm.
And a lot of times, let's just keep it real. Health insurance, life insurance is always, unfortunately, at the
At the
bottom of
bottom.
that list,
Hmm.
you know. And people are more quick to get the life insurance as opposed to having the health insurance,
Hmm.
where if you have the health insurance, you won't need the life insurance. And when
Yeah,
I
yeah,
when I say you won't need it, we all need it. But if you're taking care of your health, if you're handling some things, then that way, you know, we won't expeditiously need the life insurance policy. You get what I'm saying
yeah,
here?
yeah, yeah, yeah.
And so it's amazing to me. I like what you said. Us to click of the button, we're in control, but then we also have to take control of how we prioritize
Right,
our the setup of our life. You
right.
mentioned a few weeks ago a lot of people don't move to take the health coverage avenue, and then they have to go to the good old famous GoFundMe,
Hmm. Hmm.
when that doesn't necessarily pay all the bills either.
Hmm.
Let's talk about that when it comes down to needing the health coverage, having a procedure that you need the health coverage to take care of, as opposed to trying to raise the money after the bill has been generated. It seems like to me that that would take a domino effect, a direct hit on your credit,
Right,
on your monthly obligations now,
right,
as opposed to just doing it in the beginning, moving those some of those things that you have in the place where health insurance should be, life insurance should be. If you
right,
can speak on that.
right. Let's take health insurance and the fact that you have some upcoming procedures and things that are coming up. So what health insurance does, it automatically puts you on a budget for any unforeseen things that may come up in your life. So what you're trading is a guaranteed budget. Go with GoFundMe, you don't know what you're going to get.
Amen.
With this program, there's two things it does. One, it gives you a guaranteed budget for anything that happens, so that as long as you're paying the premiums, pretty much they cover the heavy lifting of this unlimited liability that you have with regard to when you go to the hospital or doctor. You don't know what they're going to charge. Not only that, even what they charge, you don't even know if it's fair.
Mm,
You don't even have a chance to shop it. You
hmm
can't shop it. You know,
Oh, that's good. That's a good point.
you see, you can't even shop for it. You see, you can shop for health insurance, but you can't shop for your medical care.
That's good.
You can't go to Doctor A and Doctor B and Doctor C and Doctor D and say, "What are you going to charge me for my appendectomy?" You know, because that's not the way the system is set up. And even if they gave you a number, they don't know what kind of complications they're going to run into once they start the appendectomy procedure.
Right.
So everything is like a surprise. What healthcare
Right.
does is that, irrespective of the surprises, it tells you what is your maximum out of pocket. Other than the premium, it tells you this is the maximum you will ever have to pay in a given period and within a given year. They tell you upfront.
That's good. That's good. You can't choose. Um, that's good. You can choose
Mm.
your healthcare plan,
Right,
but you can't choose the procedures that is needed to make you better.
right. You don't know.
So why not go in already knowing? It's almost like a release of the mind. I don't have to worry about that if I know it's covered.
Yeah,
Would you say that a lot of our stresses come from not being, I guess you could say, rightfully positioned when life does happen to us, like health insurance?
what's happening is that we have a lot of stress because we're going into the great unknown. You know that if you're sick and you have diabetes, you have all these different issues going on. You can't afford your medicines, you can't afford this, you can't afford that. What we don't realize is that, as I mentioned a couple of weeks back, health insurance has pre-negotiated the prices on your behalf.
Right.
It's like a Costco.
Okay.
The prices are already predetermined.
Right.
So no matter what the bill says, the final analysis is what the insurance company is going to pay on your behalf. Now, a lot of people look at the other way around. They'll say, "Oh, my insurance company's not paying my doctor enough." No, no, that's not the way to look at it. What it
Okay.
is that they have done the pre-negotiation for you already. They've already
Okay.
got it fixed already.
Okay.
So the only thing they ask you to do is you pay this premium, and the Affordable Care Act makes it affordable, so that you can afford to pay the premium, and therefore you don't have to have the stress of running to a doctor or a hospital because you don't know what the costs are.
Because it's fixed.
It's fixed. All those things are pretty fixed. And they tell you in the summary of benefits when you get your health insurance plan, this is your deductible, these are your co-payments, and this is the maximum amount of money you'll ever have to pay in any given year. They locked it down.
Better to be in the known than the unknown.
Than the unknown. You see,
Wow.
the other reason is because you know they get such huge discounts. I mentioned before that maybe the average insurance is only paying 25 cents on the dollar, but that's not your problem. But you
Right.
don't want to. So why would you want to go into an office or a hospital or anything and pay the full price?
Say that again, because yeah, I got that.
Why would you want to go into a hospital or doctor with no insurance and they send you a bill and you pay the full price?
When it's already being pre-negotiated for you, and you just have to pay your what that deductible is or what that monthly payment is,
Right.
regardless of what the bill of the procedure is. You're
Yes.
covered, is what I hear.
Yes. I'll give you a personal
Wow.
example. I'll give you a personal example. See, everything we're talking about on the program here, this is not theory. Everything that I'm talking about on the show, by the way, we're not practicing tax, legal, or accounting advice here. We're just
Right,
sharing
right,
you some examples of what people can do and what's going on.
right.
So everything I'm sharing with you, I have to eat my own dog food, as they say in the industry. So personally, I got a bill for $50,000. Okay, and by the time the insurance got through discounting everything, the bill got reduced down to $25,000. And then after it got reduced to $25,000, I got the explanation of benefits and it says patient responsibility zero. So one day I had a bill for $50,000 and the next day I had no bill. The insurance is what made that possible.
Right,
How would
right.
you negotiate it 50,000 and the bill was $50,000 for one day. One
Mm,
day. One day
mm, mm.
in the hospital.
And just imagine if you were not covered or you were not in the know the way
If
you are
if
in the
if,
know.
if I wasn't covered, can you imagine trying to figure out a way to pay $50,000? And then if you have a recurrence and you got to go back in again, that could be another $50,000.
I don't want to try to imagine that. I got a headache listening to you talk about it right now.
Is
I
that
don't want to
so?
imagine that.
So why do we want to subject ourselves to that?
Right. That makes sense.
You see,
That makes sense.
that's that's why you buy the programs.
Now, so I want to touch on a little touchy subject here. A relative of mine was showing some not necessarily COVID symptoms, but worse than a cold symptoms,
Right.
worse than a sinus infection
Hmm.
symptom. So, hey, in this year, you don't take and let nothing go by, right? Let's
Hmm.
make sure that that runny nose is, some allergies or something.
Hmm.
And so we rode around, oh God, all day Friday, trying to go and get a COVID test,
Hmm.
and we couldn't find any free sites within. And this to me makes it is so important. We could not find any free COVID testing sites uh, with spots available that you did not have to take and have an appointment.
Right.
I know within 3 county radius, uh, and so the nearest one was about an hour away.
Hmm.
And so, because we could not find the free sites here, you find the areas where you can go.
Hmm.
I didn't know that there was a free site and a paid. You had to pay. I learned something on Friday
Right.
because I thought, COVID pandemic, they're making this available to make sure that we all stay healthy. Well, see, that's me in my mind in the perfect world. But I got
Right.
a dose of reality on Friday.
Yes. Yes.
Um, the first thing and we went to a very well known, I won't say the name of the company, very well known medical facility. where they have plenty of them spread out all across the world. We went in and, well, he went in and let it be known that he was needing a COVID test. And she said, okay, well, let me see your insurance card. What? The unknown, right?
Mm-hmm.
Why do you need his insurance card to do a COVID test? I've seen lines wrapped around corners with people, getting COVID tests. So why is it a charge here? And so then she had him to come back out to the car, and she came out. She said, "Okay, so let me see your insurance card." She took one look at the card and she said, "Oh, I'm sorry. We don't honor this insurance. So it's going to be an out of pocket cost. That's $169."
Mm-hmm.
What? There's another gentleman walked up, and I need everybody to understand that health insurance is not a black thing or a white thing, because my
Mm-hmm.
brother was black and the gentleman that walked up was white and very well dressed and very obviously in distress and needed to know what was going on with him. And he got the shocker as well
Mm-hmm.
and wind up being turned away.
Mm-hmm.
So now I posted this because I'm in the world of media. I posted this that I had two very close people to me in the health industry to come back and make some good pointers. They were basically saying those tests are not free. That's why they're asking people not to take them if they don't have any symptoms.
Right.
Now I want to keep that phrase, if they don't have any symptoms. But the key thing, and this is why I brought this up, that one of the I know she's a nurse, said to me was, this is the period where you can't afford to lose your health coverage.
Right.
Because with them trying to pick apart uh, the Affordable
Affordable
Care
Care
Act,
Act.
um, if they if they do away with the part of the Affordable Care Act that covers pre-existing conditions,
Mm-hmm.
you contract COVID now.
Right.
COVID creates a condition.
Right.
You have no Affordable Act to cover it.
Mm-hmm.
Now, insurance companies can deny it to cover you.
Right. Right.
Please talk to us about that. That blew my mind.
Okay, so let me explain to you. The person who handed the insurance card to them said, "Oh, we don't accept that insurance." Let me tell you why. The insurance they had probably was not an Affordable Care Act insurance. If it was an Affordable Care Act insurance, the COVID test would have been free anywhere.
Okay.
Anywhere.
Okay.
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 See, because what happens is that people are going out buying these what we call indemnity policies. When I say indemnity policies, I mean what they do is that they'll say, well, if you get hospitalized, we'll pay you $100 a day or $1,000 a day. That's not health insurance. It's an indemnification policy. Okay. So when we talk about open enrollment, we're talking about the real Affordable Care Act programs that really cover COVID and all the pre-existing conditions and all the screenings. So when we talk about open enrollment and affordability, we're saying that this is the time you have to buy the real Affordable Care Act programs that cover all of that. But
Mm.
what happens is that most people they keep looking at insurance. They give me the cheapest, give me the cheapest. They don't get it. They don't understand what the cheapest means. What are you buying? They don't understand what they're buying. You know, there are
Right.
companies out there that are saying, "Well, we only pay um, if you get injured on the job." You see, those programs are not real health insurance. Okay, real health insurance pays if you get injured on the job too, but a lot of these companies they will specify we only pay if you get hurt and we only pay a certain amount of money. But that's not an Affordable Care Act program. Affordable Care Act program has to specifically have minimum central coverage. They have to cover pre-existing conditions. They have to pay for all the screenings, no matter where you go. So that's why this open enrollment period is so good. Because this is the time for you to get the good insurance, the real
I like
insurance.
that. I got to quote you on that. This is the
Yeah,
time to get the good insurance.
yeah, the real insurance. Not
Okay.
the stuff that looks like insurance.
Okay. So, like I said, you can imagine my surprise when people are being turned away,
Hmm.
and which means now they're having to they're exposing themselves to other people.
Now, where I live, the health department was giving them away for free. at the time, and I've had two or three tests and turned out, negative and all that, but never once have I ever had to pay. I got my flu shot. I don't have to pay. I got all these different things. I don't have to pay. Why? Because I have the full fledged Affordable Care Act program. I don't pay a dime.
That is so important because that is just so important. That is so important. Oh my God! Because if you don't have the right stuff,
Yeah.
you're gambling with people's lives, and not just the person that came to be tested, the
Hmm.
people that live in their home, and the people that on
Yes.
their job. Think. And speaking of that, we know that the world is definitely an imperfect place.
Hmm.
But when you talk about policies and things like that, I'm aware of someone that had the symptoms, called in to work, told them that they needed to go get tested, and was threatened to lose their job if they didn't come to work.
Right.
You know,
Right.
it's like there's everything is such in the so against us right now in this period
Yes.
that we can't take this open enrollment season for granted. It's just like hearing any good story, right? You can hear a good story, but until you get to the part that resonates with you, then you don't get it. I
Yes.
think today is one of those days that we really need to get it. I love the way that you put it, Mr. Poole. Um, this is the time. The Affordable Care Act will cover so much stuff that it possibly is not covered on the good policy that you think you have, like my brother.
Mm.
His policy is with his job.
Let me give you another piece of advice that people don't really get. Those of us who are authorized agents and brokers of the Affordable Care Act,
Hmm.
many of us work after hours. So even if you can't get off of work and you can't get to that government agency that's closing 9 to 5,
Hmm.
there are us professionals. I'm there to 8, 9 o'clock at night, and when we get to the final week, I'm up to 1 and 2 o'clock in the morning getting people's applications through the process. I'm not a federal agency. I'm an independent business person who believes in serving the public, and I do everything I can. Sometimes we lose a lot of sleep trying to help you get covered because you couldn't take the time during your on your job during the day.
To
So
do
I
it.
so I'm talking to you at 5 and 5:30 in the evening, 6 o'clock in the evening, getting you through the process because you couldn't afford to take time off. That's why we exist. We're covering all the gaps that people have to make it easy for them to get coverage. And then I'm doing it on Zoom. You don't even have to come to my office. I do a whole Zoom session with you, okay?
Yeah.
And we fill out the application online. You don't even have to come to me. So we're trying to make it as easy as possible for you to join the program and get the coverage. So when the government agencies close at 5 or 6 o'clock, now many of them will open longer during the last 2 weeks of open season because that's when we get this big crush of people all of a sudden. All of a sudden, people start realizing, oh my God, I hadn't done it yet, I hadn't done it yet.
The
And
last minutes.
then
Yeah.
they call. And what
Right.
happens is that they don't have anything prepared. They don't have their tax returns. They don't have their pay stubs. They don't know how much money they make. I can't tell you how many people I talk to that don't really know how much money they make, and they don't have an idea because they have funny money. It's unpredictable, you know. But it
Right.
takes time for us to figure out what is the truth.
That's right.
You see, because you got to make sure what you put on that government contract stuff. It's got to be the truth. You
So are
know.
you able to, and I can share it in the comments right now, are you
Sure.
able to let us know what we need to be ready when we call you?
Yeah. So what happens is that if you are on W-2 work, for example, you need a whole month of pay stubs. Whole month, not last month or this month necessarily, but you need to have the whole month. So if you get paid every 2 weeks, we need to see those 2 weeks in sequence. So that way we know what the monthly gross income is.
So
Okay.
2 weeks pay, 2 weeks stubs.
If you get paid every 2 weeks, then we need 2 2 week stubs
Okay.
because we need a full month.
Full month.
Right.
Okay.
And if you have a green card, we need that green card because that green card has vital information, your alien number, when your green card expires, all that sort of thing. The date you
Okay.
came into the country, you need that.
Okay.
We need you need to have possibly a copy of a tax return because a lot of times people read their tax return, they don't know what their adjusted gross income is. That's why we need a copy of the tax return that you filed in 2019.
Okay.
And for those who are self-employed, you need to know what do you now. If you're self-employed, it's not based on your gross income; it's what you take home every month. See, self-employed people, they get to take off all their deductions first, and then we get down to what do you really take home. I have self-employed people earning over six figures, but when we got down to what they took home, they qualify for the free coverage.
Mm. Okay.
But if you don't walk in with all that information at your fingertips, that's what slows everything down. You don't know your social security numbers. You don't know the social security numbers of your children. You don't know their dates of birth. I mean, these are basic things. You don't know where they live. you,
Addresses,
you
right?
don't
I
you,
know.
you don't know if you filed your taxes married filing joint, married filing separate. That's what we need to know. These are basic questions that
So
everybody should know.
needed
Yes,
documents to apply for open enrollment insurance, full months worth of pay stubs,
right,
green card information, copy of your tax returns. Self-employed needs to know that it's based on your take-home pay,
right.
not the fullness of what the company brings in.
And
This needs to.
self-employed people, because they don't keep their books up to date, they need a lot of times they don't always know what their take-home pay is.
Right.
Now, what the system does, it gives you a chance to say, it'll give you a chance to say, I made this month, this much, this month, this month, this month, and then we come up with
Mm-hmm.
an average. So we can
Okay.
average what
Okay.
the average take-home pay is.
Okay.
But
Okay.
you gotta know your numbers.
Got to know your numbers.
You gotta know where you
So
stand.
we talked about earlier, people are fearful of commitment or don't want people in their business, right?
Hmm.
So I'm looking at this, and we're talking about what you need, the documents. You got to know how much money you make, whether your green card is up to date. These are a lot of the fear factors that keep people sitting stuck and not covered.
You know, I'll tell you something else. You could be a person that is um, not a U.S. citizen, but your children were born here. Like the Dreamers.
Mm-hmm.
So we can get the Dreamers on the program, your children on the program. You still can be the primary person, even though you may not qualify because you're not, your documents not up to date. Let's put it that way. You know,
Okay.
but you still can get your kids covered. So the system design is that it doesn't punish everybody in the family for one mistake,
Okay.
okay, or something that you can't prove or whatever. And we're not there to report anybody to immigration or anything like that. That has nothing to do with it. We're just trying to figure out who in the family is here, lawfully present in the United States, that needs coverage.
That needs coverage.
That
That needs
needs
coverage.
that needs
That needs.
coverage.
I want to ride that part because that's what the people take and allow all of the other, details to blind them from the fact that hey, you need coverage. Your
Yes.
wife needs coverage. Your
Right.
husband needs coverage. Your children needs coverage.
Right.
I saw a story on I want to say it was CNN the other day, as they were talking about COVID and that entire family. And when I say an entire family,
Yep.
this young lady had lost her mom, her dad, two of her aunts, and her uncle,
Mm-hmm.
all in the run of a month
Mm-hmm.
to COVID.
Yes.
Wow.
Yeah.
And I think it is very important to point out they were of Hispanic origin.
Mm-hmm.
Um, I think that it matters when it comes down to what we know and the level of importance of getting health insurance.
Yes.
And I think we got to keep it real with ourselves. I'm not really the one for the smoke and mirrors.
Mm-hmm.
Let's keep it real. Um, Not having health insurance is at a higher rate amongst minorities
Yes.
than it is the majority.
Yes.
And a lot of time, majority of the time, that's not just because we don't know. That's because it's not affordable.
And
Which
that's the
brings us back to
yeah affordability.
which brings us back to the Affordable Care Act
Right.
and the significance of why it was created.
Right.
So I tell you, Mr. Gene, I tell you every week, you blow my mind with how you connect the dots and really, really make this thing come home for me, on how important it is to make sure that my children, my young adult children, know the importance, because it's a generational thing. If we
Yes.
don't pass down this wealth of knowledge, and pass down the level of importance that it is, then, oh God, we got a whole generation that's going to suffer because of the lack of knowledge. People perish because of the lack of knowledge. We know
Right.
that scripture. So, are you able to thank you first and foremost for letting us know about the documents that we need, in order to speed up this process to get ourselves covered?
Mm-hmm.
COVID, we have another wave that is coming through right now, and it's
Mm-hmm.
coming with a vengeance.
Mm-hmm.
Numbers have surpassed, globally where they were when we were declared a pandemic. But what's so crazy is ain't nothing shutting down. I mean, you got some states that have already decided, okay, we're stopping this, we're stopping this. I'm in Georgia,
Mm-hmm.
still wide open. You
Mm-hmm.
know, need health coverage in this period. We need health coverage in this period, because if we're not covered, only God knows, how this is going to turn out. So you shared with us the needed documents
Mm-hmm.
that we need to speed this process up. Are you
Mm-hmm.
able to show us some examples or give us some examples on how easy it is to apply?
Yeah, sure, sure. So what I'm going to do, I'm going to share my screen here. The screen's
Okay.
already up.
Okay.
So this has to do with your income and your family size. So what happens is that for 2020, if your income is 17,620 and you have a family of one, you may qualify for free coverage. If your income is between 17,620 and 49,960 in 2020, this is the realm of the Affordable Care Act coverage. This is where the system will help you pay for the premiums so that it's affordable to you.
Okay.
If let's say you're a family of four, if your income is 36,167 and below, you may qualify for free coverage. Okay. But if your income is between 36,167 and 103,000 for a family of four, you may qualify for the Affordable Care Act that will help you pay for coverage. So it's not like
Ah,
it's not like everybody's super poor. The Affordable Care Act really hits the poor and the middle class. It hits the
wow.
heart of it. It hits the middle class. Look, a family of six, if the income's between 48,521 and $138,000, you can apply for the Affordable Care Act.
Okay, you just blew up the mindset of thinking I make too much money.
Nah, no, 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 no. It's not based on that. It's based on the number of people in the family and um, whether or not you're between these income levels. In this case, 48,000 to 138,000. So a person would think, "Oh, I'm making 100,000. They ain't gonna do that for me." Well, it depends on the number of people in the family. This is why we say it's so important that we sit down with you, even though as I do in the Zoom sessions, is we go through the process of really figuring out where are you really. But you will never know where you are until you apply. You can't like just think extemporaneously out of my mind. It can't possibly make sense because you don't know the rules. And that's what people are doing. They're making decisions based on each other's families, and one that got the coverage, and the one that didn't get the coverage. You don't know how the information was presented. So what I do when I work with people is I look for the reality, and then we apply the formulas. Now, here's something else that's important. Even while you're going through this process, the system is also designed to help you so that you can get an idea how much something may cost you. So,
Okay.
all right. So now we have something in the industry called anonymous browsing. Anonymous browsing means that you don't have to identify who you are. You
To
don't have
be
to,
in the know.
you
That's
don't,
good. Come
you
on.
don't have to have your name. You don't have to have your address or anything. So look at this. This is on healthcare.gov for anybody interested. So here I'm on healthcare.gov and it says here, okay, how many people in your family? I'll say four. And I'm just going to go down this here. This is just completely free. It says, what state do you live in? Well, I live in Georgia. Okay. What is your estimated household income for 2021? We earn between $26,000 and $65,000.
Okay.
Submit. Next steps. And it tells you you may qualify for a marketplace plan with lower monthly premiums plus extra savings and blah, blah, blah. And then it also tells you things like how do you estimate your household income? You expect how this is people who are like self-employed.
Okay.
It gives you the formula for how to do that.
Oh
Okay.
wow. Okay.
Tells you exactly how to do that. It also tells you who to include in your household.
I like that. Hold on. Before
Hmm.
you change your screen, I like that in the bottom right hand corner, it says
Yes.
18 days left to enroll.
Yes. Yes. And it's telling you how many days you got left to enroll even.
Wow.
All right.
18 days, guys, in Georgia. I need the 18 days.
Yes. It's telling you. And then, so now, so we've done that. We said the income between 26,000 and 65,000, and it says get an idea of how much you'll save. So let's let's preview the plans for 2021. So give me a Georgia zip code.
30339.
30339. All right. So that's either Cobb County or Fulton County.
Uh uh Both actually.
All right. I'll just choose one. I'm going to continue. All right. So we've done that part. Then it says, tell us about your household. Well, if you had plan ID, if you had a plan, you would have an ID. Okay, who's in your household? You and other people, right?
Okay.
Okay. And then I'm going to skip the question. I want to see what plans are available because I've already given kind of like an idea what my income looks like.
Right.
So here's what it tells you. You can buy a bronze. There are 18 plans that are available for the bronze program. The bronze program means that you pay 40%, the insurance company pays 60%. But the average premium for these bronze plans for this family of four is $378 a month. The silver plans is a 70-30 plan. You pay 30%, the insurance company pays 70%. Average premiums for those is $470 a month. And then the gold plans, they have 9 gold plans. The average premium runs around $482 a month. Now let's look at all plans. So what I can do, I can scroll down here based on the zip code in Georgia, and I can choose a variety of programs. Some are lower, some are higher. But this is how quickly we can find out what the plans are, what kind of expenses they are. So we didn't put our name, we didn't put our phone number. We just had a zip code and number of people in the family and what the income was.
Okay.
We didn't identify ourselves at all.
Right.
That's how easy it is that I can get to quickly to figure out where you are, what kind of premiums you can expect to pay. Now,
Hmm.
I have some ranges, and we just gave those ranges. This is broad ranges, but what happens is that I have some premiums down as low as a dollar a month,
Yeah.
and some premiums zero. So that's how quickly we can get into the system and figure out where you stand before you even apply, before
Before
you
you.
even put your name, before you sign on a dotted line about anything.
Okay, so I'm glad that you said that because we're now this is before we even, like you said, apply, put all of our information in.
Right, right.
So do should we expect a change after we put our information in?
A change in which I mean, you mean as far as when you put your real information in?
Right, as far as the quotes that we just saw.
Okay, those quotes are averages.
Okay.
Okay, um, and they tend to average a little higher because we're
Okay.
not it's not specific. But I send people stuff and they see that it's down to $40 or $50, and they're like even more surprised.
Okay.
So it really depends on how well we do our jobs in presenting your income picture and the number of
Okay.
people in your family.
Okay.
Because as I said before, and you know this, I've talked about this before, how I got people down to $10 a month,
Right.
$20 a month.
Right.
But see, you don't get there if you don't apply.
If you don't apply, got to do the work.
Yeah.
Got to do the work. And the reality is, you guys are doing more of the work than we are. All we need to do is just apply.
Yeah, and the thing about it, those of us who are, well, we're authorized agents. Um, we're not employed by the government. Okay, we're certified by the government, but we are not employed by the government. So we are not the government. That's another thing to remember. We are not
Okay.
the government. We were completely at risk. We volunteer for this. Okay, so if you end up getting the free coverage, Medicaid, or whatever like that, I don't get paid. It's just a public service that helps you to get something that you should have had. Because remember, we said there were, prior to the Affordable Care Act, there were 40 million Americans that are running around with no insurance at all. Okay, and that, by the way, it cuts across all racial lines, including the
Yes.
majority society, because we have there are more people of the majority who didn't have coverage in the minority. By the way,
Wow.
because
Really?
their number is larger.
Wow.
Remember, we only represent 10% of the population
Well, I mean, but to
in that regard. You know.
it seems like if they have the higher income, or they, a better income financial status,
Hmm.
um, a lot of people don't get the insurance because the wealthier, the
Hmm.
majority,
Hmm.
because they can afford to pay for it.
Well, see, what I mean by this is this: uh, we have 350 million Americans, and let's say that 30% of them live below the poverty line or at
Okay.
the poverty line. What I'm
Okay.
saying is that if the minority communities represent 10 to 15% or whatever it is, I'm saying the rest of it is everybody else. They qualify too.
Gotcha.
See, so what happens?
Gotcha.
The vast majority of the people in the majority that actually can look. We have people. We have people in administrations, whether you're Democrat or Republicans, that have the Affordable Care Act. I live in the Washington D.C. area, and I know Republicans on the Affordable Care Act. They won't admit it publicly, but they're on the. But, but okay, so and let me tell you, it cuts across all swabs here. I got them. I got all genders, all races, all creeds, all every political party you can imagine. When we sit in front of them, we don't sit there and judge them because of their party or point of view or anything like that. It's just
Right.
pure. It's purely mathematics.
Right.
What I love
Right.
about this Affordable Care Act is they've made it so transparent that no one can just say you're not going to qualify for this because I don't like you, or I don't like your hair, or I don't like this or that. It's none of that. There's no room for it. It's just pure mathematics. Either you have this, your income is this, then you get X, we give you Y.
So let's sort of do a little recap here,
Hmm.
as our time is winding down. It's amazing. This hour is going by fast. I guess they say, time doesn't wait for you when you're having fun.
Yes.
Um, but I'm definitely learning so much. So let's recap. Now, we talked about, obviously, with COVID, and the numbers are um, rising. They're quickly rising, and how I'm, newly understanding that if you don't have, I'm gonna put it in your words, Mr. Poole, if you don't have the right stuff, if
Hmm.
you don't have the right health coverage,
Right.
um, you can actually be turned away from getting a COVID test. A
Hmm.
lot of people, you have free sites where you can go get the COVID testing, but here we go. How many people don't have a vehicle?
Hmm.
How many people don't have transportation to, and I, like I said, I know I experienced it on Friday,
Hmm.
within the 3 county radius.
Hmm.
um, there were no available testing free sites,
Hmm.
no available spots.
Hmm.
Okay, well, I'm sick now, I can't wait on you to have an available spot. In 2 or 3 days, I realize that I have symptoms now. Time waits for no man. And so if you can't find um, a free site, then, and I didn't know that that even existed until Friday, then
Hmm.
prepare yourself to have the $1 million question asked. Can I see your insurance card?
Hmm.
And if your insurance coverage is not the right stuff,
Hmm.
then you could be turned down.
Hmm.
And it was personal for me because a
Or pay out of
relative of
pocket.
mine, sir,
Or pay out of pocket.
I was
You-
about to say that, or pay out of pocket. It was very, it was new to me because a relative of mine was turned away from getting tested, pays for what he considers to be, good health coverage every month, but it did not provide the coverage that he needed when he also needed it the most.
Right.
And so we were told, okay, well, that's going to be $169.
Hmm.
How many people don't have the transportation, can't get there, don't have the $169 standing in front of you, sweating and snotting and can barely breathe, and all of this time is passing. Y'all, this is where the domino effect is coming. How
Hmm.
people are succumbing to this so quick because they're not able to get treatment due to lack of coverage or not having the right coverage. We talked about that earlier. And definitely, if you want to respond, please jump on in. We talked about the fact that open enrollment is right now. Open
Right.
enrollment, I just learned, will take and pay for your COVID test.
Hmm.
If you have open enrollment insurance, what is that, ShAunta? The
Yeah.
insurance that you've gotten during the Affordable Care Act, correct? Right? Open
Yeah. Now,
enrollment period.
let me correct one thing though.
Okay.
People applying for open enrollment during open enrollment, the effective date is going to be January 1, 2021. So when you're applying for open enrollment, the effective date will be January 1st, 2021. Now, here's the other part of the Affordable Care Act I want to also explain. We have something called a qualifying event. A qualifying event is when you just lost your job and you had health coverage. Okay, let's say you lost your job last month, you know, and you need coverage for say December 1. Instead of being January 1, 2021, you could possibly get December 1, 2020.
It could expedite it. It could speed it up.
Yeah. So what happens is that the way it works is that if you have if you found out you were pregnant, um, if you have job loss where you lost coverage, that coverage could start in the same year if you get the application in on time. Okay, because usually by the 15th of the month, if you want to get covered for the first of the month because you have a qualifying event, you usually try to get your paperwork in before the 15th of the month. So if you wanted to have a December coverage, like today's November 27th, it may be too late to get a December 1 because we're beyond the 15th of November.
Gotcha.
You see, so they have very specific time frames from when you have to apply. This is why it's so important that people don't procrastinate. People have to, when the moment you know you have a situation, you know, I can understand you don't necessarily want to go to the government, but you ought to be talking to people like me and say,
Right.
hey, I got this situation. What should I do? And I'll look up and figure out and say, hey, based on what you just told me, da 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 da. I haven't filled out the first piece of paper yet,
Right.
but I've given you the rules. And even though all the stuff is on the websites for healthcare.gov and it's on the state websites, people are treating, but nobody's reading.
That's good.
So, and even if they read it, they still don't fully understand it.
Right.
So you see, this is why it's so important. This is why your program plays a very vital role in getting public information out, so that people can understand that. Wait a minute, guys, we're talking to each other, our friends, and all that, but we don't call the professionals. Maybe we don't respect the professionals. I don't know,
No, we don't because y'all want our money. That's the way
yeah, you
we've been
see,
trading it fake.
yeah, you see, and the thing about it is that it's. I know that the insurance industry in the black community has not had a uh, happy relationship. Let's put it that way. But there are those of us out there who genuinely believe in what we're doing and study hard every day so that we can serve the public with the appropriate mindset. I'm not there. Unlike what you think about an insurance agent, those of us who are in the Affordable Care Act, yeah, we will make some money, but it's not like you have to pay for it, number one. And number two, we're not incentivized by trying to sell you the most expensive policy or something that you don't need. We don't get. I get the same money whether you buy company A or B or C, pretty much. So there's no incentive for me to try to push you into a more expensive program. This is what
That's
people are
good.
afraid of. People are
That's
afraid
good.
that somehow you're going to try to push it. I don't make any more money. So So it's pretty transparent for me to just talk about the things that you can actually afford. Because if you buy something that
Yeah.
you can't afford, you're going to lose it anyway and drop it anyway.
Right.
You see?
Right.
So,
That's running the business based on integrity, and unfortunately, a lot of people don't
yeah, I know a lot of
do.
people don't, unfortunately. But
Yeah.
my point is that the reason why I do it is because of the 60% of bankruptcies we have going on in this country because of medical bills, and 50% of people losing their homes because of medical bills. Now, here's another thing. I'm going to digress here for a second.
Okay.
A lot of times, people losing things because they don't let somebody know in a timely manner. So let me give you examples. Let's say you have a home and you know you're going to have some difficulty. You call the mortgage company and you tell them about it. Sometimes the person takes notes. Sometimes the person doesn't take note. You call the mortgage company before you're late because you're more likely to get help before you miss the
Before
payment
you're late.
than calling after
That's
you're already
right.
late.
That's
You see
right.
the difference?
That's right.
So what happens is that when you call in advance, and I ask people to put things in writing, 'cause I actually be in that business. You put it in writing, okay, and in that way they have a date and time stamp for when that letter came in, okay, or email. So and they're supposed to do certain things, like we have something called forbearance. There are people that hadn't paid their mortgage in so many months, whatever. They can do a forbearance, and some people get a year, some people get 6 months. You know, but those are steps that you can take. But when you are afraid and fearful, you won't even take the step to help yourself. You'll just say, "Well, I guess I'll just lose the house," when you don't
Mm,
have to.
when you
I
don't
guess
have
I'll
to.
just get evicted, when you don't have to, because they know that if you've been a good paying client all along. Tell people, put it in writing early, because the early bird gets the worm.
That's
You
good.
do it early. Don't let it just sit back and just happen. If you see there's a fire in your house and you see smoke, you're gonna try to put it out before it goes any further, right? You,
Right.
you don't let the fire go into a rage before you call the fire department, right? So in life, I'm trying to give you sort of a metaphor here, and that is, if we, those of us who are faith people, live our faith, plan early, take action early, don't let things metastasize. You got a pain in your side, you got any of these things going on. The Affordable Care Act is designed to allow you to get that checked out without any expense to you. And so we have just got to do that throughout our entire life, for everything that we do. No matter how bad it looks, take the appropriate steps
That's
early,
good. Take the appropriate
and
steps. I
you can
like
save yourself a lot of hassle.
take the appropriate steps. That was good. Well, okay. So as we are winding down, what do you want our OPNS family to take away from this segment today? This was good. This was very meaty.
Hmm.
And I love the fact that you were able to go in and show us how to go ahead and apply, and how easy it was to get to, the screen that is letting you know what you do without putting any of your personal information in. You know, so what is it that you would want them? I guess I've done my recap, and please do yours, and leave us with your
Yes.
nuggets.
Well, one thing that the system does is that when you go to apply, it's going to ask you, would you like help from a broker? Okay. And you say yes. And then it'll ask you for my national provider ID number, or, something like that, or zip code where you live. And the system will give you a list of appointed brokers who are in your area that can assist you. Okay. The reason why you want to work with a broker or a navigator or a sister is because these people are trained in this area. They know exactly how to take you through the process, no cost to you at all. They will take you through the entire process. They do it every day. They know exactly what to do. So they're not going to leave you alone just by filling out this application all by yourself. They're going to help you.
Okay.
Two, I would say that look at the appointed brokers like myself. We're available after hours. So even if you're busy, because see, sometimes when you're filling out these applications, it can take up to an hour. Even if you
Right.
have everything ready, it could take up to an hour.
Right.
And a lot of
Right.
times you don't have that type of time to give off when you're on work, right? You're working at a fast food place, whatever. You can't give up an hour like that. You're getting paid by the hour. That's why you call an agent. And the system will tell you who the agents are in your area. And that agent will tell you, yeah, I keep late hours, or I do this, or I do that. And then you have the time to get off work, get your stuff together, and get your help. You see, that's the beauty of it. And many of us, like myself, work on Saturdays. You see,
Mm.
so we don't keep bankers' hours.
Right.
We work all
Right.
these crazy hours because we're trying to help you get to where you need to be. And as I said before, a third of the people that I work for get the free coverage. I don't get paid at all for that, even when you get the coverage. But like I said, it's the right thing to do. I do it because it is the right thing to do for the public. And then the
Mm.
other two thirds get the program through the Affordable Care Act, and then the Affordable Care Act companies will pay me. So I work completely at risk. I have no salary. When I wake up in the morning, I'm working completely at risk.
Hmm.
Okay, so and that's how a lot of us are working.
Yeah.
Because we know the need is so great. So
Mm.
our thing is to do the right thing for the public, no matter what.
How can people reach you, Mr. Poole?
They can reach me. My office number is 301 925 2050.
Okay.
And if you call me or email me at info@alignedbenefitsgroup.com, even
Hmm.
if I can't do something, I'm going to refer you to somebody that can.
Hmm. That's that integrity we were talking about. And
Hmm.
we're in a time now where people are having to understand that either we're going to do it the right way or we're going to consistently get the wrong results.
Yes,
Um,
yes.
and that I think is in everything that we deal with in life.
Hmm.
Order of operation, putting things in their respective places. Um, we'll go and buy the makeup.
Hmm.
We'll buy the latest clothes.
Hmm.
We'll buy the latest jewelry, the latest fad, but we won't take that same dollar to invest to literally save our lives.
That's correct.
Um, Open enrollment is real. I was smack dab, in the middle of learning about open enrollment in 2008. Um, and I understood the significance. And just like with everything, when you have something new come on the board, you're going to have some people that love it, like it, right?
Hmm.
Or hate it, despise it.
Hmm.
And I think those that see the value take advantage of the value.
Hmm.
Those that don't see the value, well, because there's no value in it for them, well, obviously it's their job to talk against it. But I
Hmm.
love the way you showed the scale there with the broad money. If you make this amount of money and you make this amount of money, understanding that you still can receive the coverage and the program is set up to help you pay if that monthly amount comes out a little too high. People perish because of the lack of knowledge, but we're in a place right now where I think the steal of the land has provided opportunities that we didn't know existed because we were so busy doing everything else. And this opportunity to be able to get in front of the people consistently, consistence bring about results. You pay that car insurance every month, that car note every month, that mortgage every month, because you know that these are the things that you need. But I think people need to understand that health insurance is just as important.
Hmm.
Would you agree with that?
And in fact, your health is your wealth. So you want to do everything to ensure that your health is still working so that you can work. But if you're in pain and you can't see and you have all these other issues and you don't go take care of that, you're risking your health. And if you risk your health, you've also risked your wealth.
That, your health is your wealth.
Yes.
Wow.
Don't risk it.
These are great nuggets, and I'm definitely wanting to make sure that the people that view this in a replay get the fullness as much as they can, because the reality is, um, we grow best together. I
Hmm.
know what I know, and I think that I'm good at what I know, but I don't know what you know.
Hmm.
And I've come into the understanding that I need to. I need to know some of what you know in order to live my best life. Um, so, I mean, wow. Just thank you yet again. Thank you again for pouring into the OPNS family. And I do know without a shadow of a doubt that we have been made better. I heard you say the other day that you have had some people to contact you and to inquire and set appointments. And that's it. You know, we come
Hmm.
before you, we take the time to be right here. I love the way you said, which is crazy. We shouldn't have to, but to
Hmm.
some people it matter. I'm not being paid to sit in front of you either. I
Right.
believe
Yeah.
that this is what we're supposed to do. This
Hmm.
is kingdom work, you know,
Yes.
and when you are about kingdom work and planting seeds in the kingdom that you're wanting to grow God's people, I believe He grows everything that we're attached to, you know.
Absolutely.
So, thank you again, Mr. Poole. This has been good. I've written down my notes, and I'm looking forward to making sure that I have the right stuff because knowing what I found out on Friday and seeing my, you know, my brother without any hesitancy, bam, here go my insurance card. And to get it back, bam, that ain't gonna work. Wait a minute. What does that mean? It's where they taking my money every month, every week. So
And,
definitely learning
and the fact that they didn't accept it, it tells me that it probably wasn't the affordable health care insurance. It's
because you
probably,
know without a shadow of a doubt, it
yeah,
would be covered.
it would have been covered.
All right, guys.
Hmm.
That has been our pool of wealth. You called that right? Our
Yep,
pool
yep,
of wealth.
yep,
Okay, I
yes.
just want that has been our pool of wealth today on this fabulous Friday. I know you're probably a lot like myself and Mr. Poole, wanting to find a couch after eating so much on yesterday. But you know what? Hey, health doesn't wait for no man.
That's
Issues
right.
don't wait for no man. So, regardless of what time of year it is, what season of year it is, we got to be about our business, as
Hmm.
Bella Biz would say. So I thank you so much, and I look forward to seeing you again next Friday.
Hmm.
OPNS family, go and eat your second helping of Thanksgiving dinner, and just make sure that you got your health coverage. Because I know, you know, for me, sometimes I eat certain things and it didn't agree with me, and I might need to go to the hospital. But
Hmm.
oh, what surprise is going to be there if I don't have the right stuff? So
Hmm.
make sure that you reach out to Mr. Eugene Poole. His information is in the comments. 301-925-2050, or you can email him at info@alignedbenefitsgroup.com. This is ShAunta Moore right here with OPNS 97.1. Enjoy the rest of your holiday weekend. I'll see you soon. God bless.
And thank you.